After years of secret negotiations, WikiLeaks has shone a light on the Trans-Pacific Partnership, the proposed regional trade deal between Pacific Rim countries, including Australia. If it goes ahead, it could be a huge win for big pharmaceutical companies, but a blow for generic drug makers and public health resources. Rebecca Nash takes a look.
After years of secrecy and rumour, the big reveal, courtesy of WikiLeaks. It's got hold of the draft text of the Trans-Pacific Partnership's chapter on intellectual property rights. If accurate, many say it will be a bitter pill to swallow.
I think the Trans-Pacific Partnership kind of provides a Christmas wish list for major corporations.
On the whole, I was expecting to see something pretty long and horrific, and that's what we see.
What's concerning legal experts are the proposals to extend patent protection and strengthen monopolies on clinical data, measures designed to protect pharmaceutical companies from the rise of generic drugs.
The broader impact of all of that is likely to be higher costs for medicines.
And there's a great deal of concern in Australia that the government not trade away public health in order to secure other trade objectives.
But the local pharmaceutical lobby group denies much would change if the draft were agreed to. Its CEO says Australia's been down this path of speculation before.
When the Australia-US Free Trade Agreement was being negotiated 10 years ago, there were a lot of academics and people in the media getting hysterical about medicine prices.
The Australian taxpayer subsidises the cost of medicine through the PBS to the tune of $9 billion a year. Many of the PBS-listed drugs are under patent, and when that patent expires, those drugs drop at least 16% in price.
We already have the most generous pharmaceutical patent scheme in the world, and we're already paying more than we should be for pharmaceuticals.
Tony Harris's pharmaceutical patents review is before the new government, arguing for a more frugal patent system. He says an overly long patent actually stymies innovation, just like it did with James Watts's steam engine nearly 250 years ago.
There was no development of that steam engine until the patent expired. As soon as it expired, we got significant better steam engines than Watt had invented.
But Brendan Shaw argues the stronger the patent system, the more innovation.
When it takes 15 years and $1.5 billion to develop a new medicine, you need to make sure that the patent system is going to be there to protect your intellectual property and the investment in research you've done.
But despite Medicines Australia's assurances the proposed trade agreement won't affect the production of cheaper generic drugs, concerns remain for public health.
Critical issue is the question of access to essential medicines, particularly for HIV, AIDS, malaria and tuberculosis.
The prescriptive nature of the draft is also causing concern among legal experts, who say it restricts a government's ability to react to technological changes.
This level of detail just isn't appropriate to be negotiated in secret without full democratic debate about the content.
But the detail may in fact be the undoing of the Trans-Pacific Partnership.
If the rest of the agreement looks anything like this, I think there's real doubts as to whether any other country is ever going to want to join. And so, even if the TPP gets agreed, I think it could end up being a bit of a lame duck.
An overdose of a trade agreement, perhaps.